Dr. Chatterjee also joining us on the broadcast from Delhi. Dr. Suranjit Chatterjee is a senior consultant internal medicine at the Apollo Hospital in Delhi. Dr. Chatterjee, there is panic as far as the national capital is concerned. There is shortage of beds. We've seen over 100 deaths being reported for 2 consecutive days, over 17,000 cases. How grim is the situation as far as the national capital is concerned, and how effective, therefore, you think these weekend curbs are going to be?
The situation is quite grim. It is really rampaging. I am always using this word that the coronavirus is on rampage in the city right now. All age groups are getting infected, whether it is elderly, whether it is younger, whether it is children, everybody is getting infected. And what is also happening that I am seeing is quite a few people are willing to stay at home, which is right for milder cases to stay at home. But what they are not realizing is the red flag signs. Patients are becoming much more sick at home and then getting shifted to the hospital, which is a bad sign, and that will increase the number of mortalities in the city. So we have to be very careful. I'm actually for home management of the cases which are milder or asymptomatic, but they have to be in constant touch with the doctor who is treating them, because the red flag signs have to be understood.
Okay, so you're making a very important point. You're saying that if you do choose to isolate at home, you must be in touch with your doctor, because a lot of people are actually coming into hospitals a little too late. This is an advisory that's been issued by doctors, several times before also. The opposite is also true. If you have a milder infection, stay at home under medical advisement and don't go out looking for a bed. Save it for, a critical care patient. I want to ask you, Dr. Girdhar Babu, is there scientific evidence to back these weekend curbs or night curfews? Do they actually help in curbing the spread of COVID?
More than the evidence, I think these are notional to sort of create some kind of motivational atmosphere for people. If things don't go well, there might be more restrictions. So it's better that we start COVID appropriate behavior. I do not see clear evidence. There is evidence in the West where in the night there are most parties occur, and therefore by having a night curfew, there is actually decrease in the congregations in the pubs and such parties. As a result, there is decrease in the overall cases. But I don't think this is the same scenario in India everywhere. So therefore, if you were to do an effective night curfew, maybe that should begin something like 6 o'clock. But having from 10 to 5 does not actually make any difference in reducing the cases.